Thanks so much, Tawana. Well, this Tuesday we are talking health, and this morning I have Miss Sherry Howard. She's with Greenwood-LaFleur Hospital. Welcome, Miss Howard.
Thank you. I'm glad to be here.
We're glad you're here too. This morning we are talking sleep apnea, and this is the month of learning about this. Tell us a little bit about, maybe I'm sure those that are out there that have trouble sleeping or probably have a lot of questions. What is sleep apnea?
Sleep apnea simply is that when the person falls asleep, they stop breathing. They literally stop breathing in their sleep.
And that's really scary and dangerous. Let me ask this. When we talk about sleep apnea, is there a certain person that's more possible to get sleep apnea, or what causes it, and how do you get it?
Actually, there are several things that can contribute to sleep apnea or that could cause it. A lot of it is genetics. I mean, it's just your genetic makeup. And it's partly just your physical makeup. Of course, you know, if you have weight has a lot to do with it. Mm-hmm. But even athletes, people who you think of someone who's a big, burly football player, and he usually has a thicker neck. Mm-hmm. And but that can also, just your physical makeup can contribute to sleep apnea.
What are some of the symptoms that when sleep apnea? Obviously, they don't breathe, but I mean, is there anything else that goes with it?
Well, the primary thing and the most common thing is snoring. I mean, if you snore, it doesn't automatically mean you have sleep apnea, but it's one of the telltale signs of sleep apnea.
Wow. What do you? I mean, when somebody comes to you and they've got this, what is the diagnosis, or what's the procedure for getting them help? Well,
the first thing, of course, if they suspect that they have a problem, they will have to see one of our sleep physicians. So they would see him, and if he'll do his workup and his history and physical. And if he decides that he feels like he needs to spend the night in the sleep lab, mm-hmm. then they would come there one night. Of course, they'll come there that night, and they're usually there from about 8:30 p.m. until around 6:30 the next morning. Mm. And of course, you know, a lot of people think this is painful. I've even had people who ask me, well, is it going to hurt? Or do you have to draw blood, things like that? And you don't. Now, there are a lot of wires and sensors that we use, but none of it's painful. It just looks kind of funny.
And that kind of follows my other question. Is that really how you diagnose somebody, is really that overnight stay?
Right, exactly. Like I said, the primary, the most common sleep disorder is sleep apnea. Mm. And it requires an actual night in the sleep lab.
Now, if somebody, just finishing out this morning, what does treatment look like? If somebody does come in and they do have it, what do you do for them that really kind of sets them up for success?
Well, the go-to thing would be what's called a CPAP machine. Mm-hmm. Actually, this is a machine that the patient would sleep with each night. And what it does, it just helps to keep the airway open. Mm-hmm. It delivers positive pressurized air to the airway, and it keeps the airway open so it doesn't, you know, block off while they're asleep.
And definitely if you're in one of those situations where you're not breathing at night, that's something that's very helpful.
Oh, yes.
If somebody wants more information, they want to find out more about this, how can they do that?
Well, of course, you know, it's Greenwood-LaFleur Sleep Disorder Center, mm-hmm. and our number is 459-2785, and our website is www.glh.org.
Fantastic, fantastic. Well, Ms. Howard, thanks so much for staying with us this morning and giving us that updates. If you would like more information, glh.org, and be sure to check in, even if there's even the slightest concern, right?
Right, yes. Yes.
Fantastic. Thanks so much. Well, stay with us. Coming up after the break, we've got more Good Morning Mississippi. We'll be right back.
This Health Matters segment is brought to you by Greenwood-LaFleur Hospital.